Good morning.
Good morning, Chair, Vice Chair, everyone. My name is Yoli Diaz. Last Monday, I sent an email to more than 80 individuals regarding a resident who was denied an appointment after the Memorial Medical Center Cancer Center contacted her on May 7th, 2026, regarding her referral dated May 6, 2026. The resident reported that the Memorial Medical Center Cancer Center was apologetic and informed her that they could not attend to her, not see or treat her without insurance. This is the same issue I repeatedly heard from residents over the years, and the very reason I met with then County Manager Fernando Macias and then Mayor Ken Miyagashima in 2021. I want to thank Commissioner Gameros and Anthony Turner, the City of Las Cruces Public Health Coordinator, for stepping in and contacting Memorial Medical Center to also advocate for the resident. Following our efforts, the resident was ultimately provided an appointment, and I appreciate their assistance in helping address this matter. However, serious concerns remain. The referral to the MMC Cancer Center was made by an MMC physician, an MMC surgeon. The resident was referred by the New Mexico Department of Health Breast and Cervical Cancer Early Detection Program, also known as the BCC program, to Memorial Medical Center. This means that MMC already knew the resident was in a state-assisted cancer screening program, uninsured and low income. The MMC referral signed by the surgeon is clear and states diagnosis, invasive carcinoma of breast, primary insurance, BCC program, secondary insurance, none recorded. What is especially important to understand is that the BCC program also faces funding limitations. The program is reportedly funded to serve only about 15% of the eligible population. In addition, BCC Medicaid is a special category of Medicaid, and not all women diagnosed with breast or cervical cancer qualify. As a result, this resident and many residents continue to face multiple barriers when trying to access cancer treatment, which I've repeatedly reported. The fact that a resident reportedly was not provided an appointment because she was uninsured raises significant concerns, especially given the years of public discussion surrounding the barriers to cancer care access at Memorial Medical Center Cancer Center. It also raises important questions regarding Memorial Medical Center's own stated screening workflow procedures. According to the screening workflow document provided to me by MMC CEO Dennis Knox in December 2026, there should have been screening for insurance coverage, screening for CHAP, the County Healthcare Assistance Program, and screening under the Patients Debt Collection Protection Act. In an email provided by Mr. Knox, in which I question his assertions, he states,
Thank you, Ms. Yes.
we're right there. Here.
Good morning, Chair, Commissioners. My name is Candace Avalos. I'm going to finish reading what Yoli had to say. We appreciate your continued commitment to advocacy on behalf of patients and believe direct collaboration is the most effective way to resolve concerns and improve outcomes. As part of that, we would appreciate your support in encouraging patients to provide the necessary information required to help connect them with appropriate coverage. When residents contact Yoli, the action by Memorial Medical Center has already occurred. In this case, the resident reporting the denial by MMC Cancer Center was a completed action by the MMC Cancer Center. The responsibility to financially screen residents, determine eligibility for assistance programs, discuss available indigent resources, and review available coverage options belongs to Memorial Medical Center, not to her, not to myself, not to the patient advocates, and not to vulnerable residents navigating cancer diagnoses on their own. The central concern remains that this should not have happened in the first place. The resident reported that no screening occurred. Had MMC properly screened the resident, staff would have learned that she was already an active client in the Doña Ana County Health Care Assistance Program. To make matters worse, Memorial Medical Center reportedly attempted to re-enroll the resident into the County Indigent Care Program, even though she was already actively enrolled. This is another repeated concern residents have experienced involving MMC. Again, this issue is simple. This also should not have happened in the first place. Residents facing cancer should not have to navigate repeated barriers, fear, confusion, delays, or unnecessary administrative obstacles in order to receive medically necessary care. These are not just paperwork issues. They are serious concerns involving vulnerable residents seeking cancer treatment. While I appreciate the efforts that ultimately helped secure the resident's appointment, concerns remain about why these situations continue to occur at all. We respectfully ask for continued oversight, accountability, and meaningful corrective action to ensure residents can access timely cancer care without unnecessary burdens or barriers. Communication with all contracted indigent care providers is critically needed, especially with staff that provides the first contact, such as eligibility specialists and new patient coordinators. Although I understand Doña Ana County is now working on updates, it is very important to establish policies and procedures for patient navigation and care coordination that all contract indigent care providers are required to follow, that all residents can access all contracted services. Thank you all.
Thank you.